I've just been overusing my instrument. I've done a lot of performing, I've done a lot of teaching. And one day I took a student in for a stroboscopy because she was having issues with her singing voice. And while I was there, I said, hey, can we just do just a check-in for me? And they put the camera down my throat, and there was complete shock in the room because my vocal cord was actively hemorrhaging. And the doctors who were there had never seen an active bleed before, like occurring right there in their office. And at that point kind of said, Danielle, you're at a point in your career and this is the type of injury. She said, I suspect that all the vocal trouble you've had from the time you were a freshman at Butler to now has actually been caused by this blood vessel that's been hemorrhaging on and off and on and off. And if you don't get it cauterized, you could risk vocal damage that will actually really impede your career.
And that's what makes this a really great tool, especially for singers and performers, where there's just a small vessel, there's not a big bump, there's not something to cut off, but it gives them tremendous success sort of down the road, and again, just helps them in their overall performance because they're not having these recurring bruises.
Of course, I resisted that for a long time because in the professional voice world, having surgery can be career-ending. It also kind of makes you a professional pariah. And so I resisted for a long time until I started to lose my voice maybe every other month. And that's when I said, obviously I'm at a time where I have a decision to make. I either can stop being a professional vocalist or I can have this surgery and see what happens. And so that's when I was introduced to Dr. Rebecca Howell and her amazing team at UC Health. Many of the folks on Rebecca Howell's team, classically trained vocalists, so I knew I was in good hands because I was getting folks who were approaching me not only from an extremely educated, expert medical perspective, but also knew what I wanted to preserve in terms of function for my career.
What we do in our clinics, which is unique to this area, is that we have multidisciplinary teams. So if there's something that patients are looking for, oftentimes we have somebody that can actually address that specific thing. And so what ends up happening is, especially when patients come in for their immediate post-op visit, they're seen again by both a speech pathologist, usually it's a voice-trained speech pathologist at that time, and then myself. And at that time, we decide together what does their next week look like.
When I came out of surgery after my period of vocal rest and I started rehabilitation, within a couple of practice sessions, I became very aware that I had a vocal cord that functioned differently and much, much better than it had before. And I'd never operated with an instrument that was fully functional before. I knew what the possibility was in terms of failure, and I walked out, like I said, I went from having like a really nice sedan to a Porsche in my throat, and so it was beyond my wildest dreams in terms of a positive outcome. So I would just share my story, and I would be like, don't you want to drive a Porsche, right?